Atal New India Challenges for the micro, small, medium enterprises and startups. These are called ARISE Challenges, the Applied Research and Innovation for Small Enterprises, which has been recently launched by the Atal Innovation Mission just a few weeks ago. And I'm delighted today to have a conversation on this subject with two distinguished specialists in this regard. But before I do that, first of all, I do hope that every one of you are safe and healthy and hearty in spite of these very difficult COVID-19 circumstances that we all are living in and experiencing. I do hope that you're also practicing the safeguards that have been advocated by your authorities, by your local institutions, or by the local government. We are indeed living in very difficult times, the COVID-19 times. This has been an unprecedented experience for almost everyone in the world. It has created grievous disruption to lives and livelihoods across the world. It has created national lockdowns. It has created disruption in supply chains across the world. It has inflamed nationalistic fervors in many parts of the world because of COVID-19. And it has also created the fear of uncertainty of what is there tomorrow, what is in store for us tomorrow. Not just the effects of this pandemic that we are experiencing, but of potentially other pandemics out there in the horizon that we don't know about, or potential effects of climate change that we have been talking for long, but which are not yet being experienced the way we are experiencing this COVID-19 crisis. So what when these challenges come along, and how do we prepare ourselves for a newer world to live in? We are also having a unique opportunity at this point in time to leverage some of the good strengths that our country has been having and experiencing over the last several years. We have what they call as a demographic dividend, which is the envy of many a country. We have 1.3 billion people with more than 150 million young students entering into the workplace over the next 5 to 10 years. We have 65% of our country under 35 years old. And that's a tremendous youthful energy available to the nation to transform itself and to be progressive. We have been one of the fastest growing economies of the world over the last several years, barring this COVID-19 crisis. We are also risen extremely fast in the Global Innovation Index over the last 5 years. We were in a position of 81 in 2015, and we are today in a position of 48. So that's a remarkable advancement for a young country like India. We are also living in the world where technology is becoming affordable, accessible, available, and advanced. We have 3D printing, robotics, IoT, miniaturized electronics, augmented virtual reality, artificial intelligence, blockchain, making their impact. Sensor technologies are enabling the convergence of advanced communication, computing, and data technologies to come together. And therefore, artificial intelligence has become central to our thinking and to the innovations that are possible. And so the Atal Innovation Mission, which was formed about 3.5 years ago, has been at the forefront of creating and promoting an ecosystem of innovation and entrepreneurship across the length and breadth of our country through several initiatives that you are aware of. These include setting up thousands of Atal Tinkering Labs at the school level, world-class incubators, fostering world-class startups at a national level, at the university and institutional level, creating Atal Community Innovation Centers to be able to service the needs of rural India, of tier 2, tier 3 cities, of the 600,000 plus villages that we have, of the 715 districts we are comprised of, and of especially addressing the needs of the 115 aspirational districts that our country has. And we are also a country where we have only 8 tier 1 cities, but we have more than 8,000 small towns and cities. And we need to ensure that the needs of rural India, tier 2, tier 3 India, the hilly coastal districts are also met through innovation, through entrepreneurship. And therefore, these community innovation centers, Atal New India Challenges, and the ARISE Challenges form a very important part of what we are trying to do as a result of creating this ecosystem. I am delighted today to have two very distinguished panelists who can benefit us with their knowledge, their experience, their insights, their observations, and their deep association with the healthcare industry. We launched 3 challenges with the Ministry of Health and Welfare, Family Welfare. One was on health data analytics. How do you use data analytics? How do you use big data? How do you use artificial intelligence, for example, in identifying early breakout of epidemics based on a historic curve and data? The second challenge was on identifying and creating AI solutions, artificial intelligence solutions, solutions for antimicrobial resistance and surveillance. This has become very important in the COVID-19 crisis. And the third, which is also very important for India, is healthcare monitoring. How do you monitor healthcare? And in particular, how do you ensure that the logistics of cold chain and immunization programs are becoming more and more effective? Now, all this requires tremendous amount of innovation and tremendous amount of entrepreneurship and tremendous amount of technological leverage in order to address these problems. So let me, without more ado, introduce the 2 distinguished panelists. We have Dr. Jitendar Sharma. He is the adjunct faculty at the University of Adelaide, Australia, and he supports the World Health Organization headquarters in Geneva as an expert advisor for medical technology on technical matters. He has authored 2 books and 20 research papers. He has been a designer and a coordinator for several technology-intensive programs in India and teaches courses on technology policy globally. He was awarded the European Union India Young Leaders Award at the European Union Parliament for his distinguished work. Dr. Sharma has 2 PhDs, 4 masters, and 7 fellowships. And his trainings include those at reputed institutions such as AIMS, Uppsala Monitoring Center in Sweden, PMDA Japan, JBI Institute Australia, and the Harvard School of Public Health USA. We cannot have a more distinguished person and a more accomplished person to be talking today to us. He has also been associated with the Atal Incubation Mission and the Incubation Center that we have set up at MedTech Park in Visakhapatnam. Thank you, Dr. Jitendra, for joining us today on this very important panel discussion. We also have Ms. Preeti Syal. Preeti is a senior specialist at NITI Aayog, working at the intersection of technology and healthcare policy, among other frontier technology focus areas. She has more than a decade of experience in developing wireless, smart camera, and AI algorithms for global companies in the United States, Latin America, Taiwan, and India. She has successfully started her AI healthcare startup. So she definitely knows what not to do for startups and innovation. Preeti has a master's in computer networking from North Carolina State University and also has a master's in public policy from the University of California, San Diego. Thank you, Preeti, for joining us today on this very important discussion. So I turn it over to Dr. Jitendra Sharma. The 3 challenges that we have launched, the importance of innovation and entrepreneurship in healthcare, the integration of AI into medical devices and into health monitoring and into data analytics. Do give your perspective on what are the challenges, what are the opportunities, and why is it so exciting to be part of this ARISE challenge?
Thank you, Dr. Ramanan. Can you hear me?
Yeah, I can hear you.
Yeah. So thank you very much for a very humbling introduction. But I think the most humble introduction I feel I have is being a senior fellow at the NITI Aayog. And therefore, it's a privilege that is ahead of anything else. You mentioned a very important thing in your opening remarks. Has the world slept when India, from 81st position in 2015 in Global Innovation Index, jumped up to 46? That's almost an incremental jump of 400%, which is by no means a small achievement. And I think the role Atal Incubation Mission has played is out there to see for innovation clusters and innovation missions to learn and benefit from. Now, as a founder, CEO of India's first medical technology park at Visakhapatnam, AMTZ, we had the privilege of setting up an Atal Incubation Center with support of the Atal Incubation Mission, particularly the leadership that you show towards every innovation effort. And the Atal Incubation Mission is, I am not sure if you are able to see a yellow building behind me, but that's the Atal Incubation Center. Now, as a chairman of that Atal Incubation Center, let me tell you that robotic surgery system, which is the future of surgery, today has only one company in the world out of the US with its master blaster product called Da Vinci. Just one in the world, only one company. And the second company to make robotic surgery system, in fact, a robotic cardiac surgery system, sits in that Atal Incubation Center behind me. And that tells you what Atal Incubation Mission has achieved. It's not just 1,000 apps like Uber, but a lot of medical technology rocket science that has emerged as part of these efforts. Now, coming to the topics of discussion, I would just present to you 3 examples. And these 3 examples have their own stories to tell and own lessons for us to check in. Number 1, health data analytics. In 2015, when I was part of the Ministry of Health, we designed the National Diagnostics Program of India, the largest diagnostics program that works under public-private partnership in several states of the country today. So when we designed this program, which was inaugurated at that time by the Honorable Health Minister, we have a sample collection facility even in a primary health center and a sub-center where authorized labs collect their samples, take it to the mother labs, analyze using good technology equipment, and the cost per test, cost per sample is paid through the National Health Mission. This started as a service program. Today, we have more than 2.2 billion diagnostic data points in the servers in several states where this program is working. We did something interesting with a partner. In one of the states where there were more than 700 provinces, mandals, sub-district provinces, all the data points on diagnostics, when you mine it, as you rightly mentioned, some of the tools that you mentioned in your opening remarks, when we mine this data, we realize that in 54 mandals, the triglycerides are constantly rising. No, that was not the job or mandate of the diagnostics program. Diagnostics program's mandate was only to provide diagnostic tests. But when you mine this data, and nobody better than Ms. Preeti will know the benefit of this back-end work, when you mine this data and see that in 54 mandals the triglycerides are rising, anybody from a clinical background would know that's a marker of potential diabetes. Now, in that state, we worked with the food supplies department, and in those 54 mandals, in the fair price shops, the free ration shops, white rice was substituted with brown rice or pulses. And after 1.5 years, you see the triglycerides declining. Now, this entire intervention, sitting on the platform of data mining, coming out from diagnostics funded by National Health Mission, had nothing to do with diagnostics. It had to do with convergence of food supply, civil supplies, data mining, and a program that's already happening. This can change a lot of things for health sector. This is just one example. How many ultrasounds do we do in the country? Have we seen correlation between ultrasound images of fetus minus the gender image, which is prohibited by law under PCT&DT Act? Have we ever checked the correlation between the images and the potential anemia status or malnourishment status of the children? These are things to explore. We do, even under Ayushman Bharat, thousands of cath procedures. We put stents and government pays for it. But have we analyzed those thousands and thousands of mined cath lab images? It could tell us a lot of things where actually intervention could not only save lives, but also can save funds. Second example, AI solution antimicrobial resistance. You see, antimicrobial resistance happens by taking antibiotic or getting exposed to antibiotics that are in fish or milk or some other form. Now, prescription of antibiotic is most necessary, which in unorganized economies like India may get bypassed in tier 2, tier 3, tier 4 cities. And we set up MedTech zone in a tier 2 city in Vizag. They call it a sleeping village, which now has MedTech. India's first superconducting magnet for MRI is being built here as we speak. Robotic cardiac surgery systems are being built as we speak. But it's a tier 2 city. Now, in these tier 2 cities, the prescription pattern of antibiotic is not based on microbiology reports, which means one, a physician may prescribe an antibiotic you are not sensitive to because the report takes time. Two, people can actually go into a chemist shop and take antibiotics bypassing the prescription itself. Now, what do you do? Now, if prescription of antibiotic can be tagged on app, we tried doing this with one of the providers like NetMeds or 1mg, that every time a chemist sells an antibiotic, it's tagged to a prescription code which is generated, and you can see the stock position of antibiotics in a chemist shop, and no antibiotics can be sold until that prescription code is generated, and the chemist on their app of 1mg or NetMeds can actually accept that order. Like Swiggy, you cannot even prescribe antibiotics. That is actually solving the root cause, which is one, taking antibiotics, prescribing antibiotics without a microbiology report, a culture report. Two, taking an antibiotic without even a prescription. Again, an area where startups can actually go out there and work. The third, which is monitoring of healthcare and monitoring of cold chain vaccination. We have a beautiful center in National Institute of Health and Family Welfare campus in Munirka, where we have a national cold chain coordinating center, where a lot of thermal imaging, barcoding, temperature linking with barcode of vaccines work is going on. But healthcare monitoring goes beyond this. Now, there was one session where a very profound intellectual was actually arguing, rightly so, even if we were to monitor thousands and thousands of data points of blood pressure, what's the use? Because the storage of data also costs, right? So we need to understand that we need to store and analyze only that data which is important, because data storage and data mining just as a business with no clinical gain may not be sustainable, because over a period of time, the health ecosystem would reject that because of no gain. And therefore, I think there is a need that we filter out what is worth monitoring, what is not worth monitoring, and that domain which is worth monitoring, can we link it to solutions which are outgoing there in the market, which are already being used in the market. For example, in all hospitals, we have ICUs, and ICUs have monitors, monitors have data points. But in this data point, one single piece which is important is correlation of pulse oximetry, which is oxygen saturation, SpO2, with the ECG. Nobody has actually done that correlation. So, as you rightly mentioned, there are very bubbling problems which are important from the burden of disease perspective and the trade and business sustainability perspective that are out there. These challenges that you have brought out under your leadership in so many years in NITI Aayog, many such challenges, including the one arise. A very, very outcome-centric approach is important. And if this outcome-centric approach can be tagged to the existing health ecosystem, we avoid duplication with faster gains. With that, over to you, and thank you for the opportunity. Looking forward to continuing to communicate.
Thank you, Dr. Sharma. I think that was a fantastic insight into the not only the opportunities, but also what is actually the challenge, that we are all facing. And I think it's also very heartening to know that Indian ingenuity can have global impact. And you're showing the way through the robotic surgery center that is there, and which is the only one outside the United States, and which is being created in the Atal Incubation Center. My heartiest congratulations to the entire team under your leadership who are doing that, because it is actually that is the possibility for all the young innovators who are out there. You have the possibility, and India has the possibility of creating innovations that are much needed, not only in India, but across the world. As the CEO Amitabh Kant of NITI Aayog always says, any solution that we develop for India for 1.3 billion people is also a solution for 7.3 billion people on this planet. So we have, and also the Honorable Prime Minister has been saying, be vocal for local so that you can go global. At the end of the day, it is Indian ingenuity with global impact is what we are looking for, and I'm sure these innovations will come to bear. Now, Preeti ji, you've had extensive experience, and some of the points that I think Dr. Sharma mentioned about the supply chain. How important it is in the supply chain to be able to use artificial intelligence and new technologies, maybe IoT technologies and sensor technologies, to be able to identify the gaps and address those gaps for not only healthcare monitoring, but healthcare administration. And the second is he very beautifully brought out the example of how through data mining and through data analytics, you may stumble upon other possibilities and other results, which in order to resolve will need not a technology intervention, but it may need an intervention of the government, the food supply chain as it is there, the education and awareness of these are, there has to be a lifestyle change that people have to adopt, and all of those. So, in the light of what Dr. Sharma said, what are your thoughts on some of the immediate opportunities that present themselves in all these three areas, and where technology can play an increasingly useful role in speedily addressing these problems and bringing agility in the solution of the problems?
Thank you, Dr. Ramanan, and thank you, Dr. Sharma. That was very impressive. I had no idea all of that was going on right here. Yeah, that was very impressive. So, just talking about the questions that Dr. Ramanan has posed, I think I'll take the second question first because that is closer to my heart. Being able to leverage information from one sector to the other. I think that is a very big piece of data mining that is often ignored. We always think that you can only bring out information that is useful for a particular sector if you know about that sector. But more often than not, it is the other way around. Like, for example, if we think about the current pandemic, the first notification that came out was December 30th, which came out of an AI company which monitors social media. So that's the company that was actually talking about and looking into how people travel, how people are posting their information on Twitter and talking about their general wellness, and information sharing as far as the mood of the community goes. So this company was strictly monitoring social media, and they predicted 9 days before WHO actually declared a pandemic that possibly there is something going on in healthcare sector. A pneumonia-like, flu-like situation is building up, and that company was actually not even based out of China. They were based out of San Francisco. So being able to monitor social media from that distance and actually predict something, I find that very fascinating. And in the sense that you were able to relate the two sectors of agriculture and healthcare, although they, in some sense, are kind of coexisting. I mean, all the nutrition and all the elements of nutrition that go into healthcare should eventually be tied to agriculture. And I think that is one segment that we should probably be co-working to enable. But yeah, that's a very good example of how data coexists in silos. But if it starts talking to each other, you can see wonders happening. Adding on to that WHO example that I just gave, there's another company that only monitors children hospitals around Boston. They do the same thing. They only monitor the patients coming in and out. It's like an operational based AI system, but based on that information, they were able to correlate symptoms of transmission, how fast the pandemic is progressing among children based on the information of intake of patients within a given hospital. So the correlation, the information is everywhere. And for entrepreneurs, this is very exciting because you really don't have to be a medical expert to be able to build a technology in healthcare. Think outside the box. Try to think in terms of what if, for example, Ramanan sir talked about supply chain. If you think about supply chain, any legacy supply chain, how food travels, for example, from farm to your table, that supply chain in itself has so many elements that you can correlate directly to healthcare supply chain. Because in some sense, food is also living, and you need some maintenance as far as the flow of the produce goes. So in healthcare, you have similar elements. I mean, of course, they're more controlled, and there are elements that will be more specific when it comes to cold chain supply. But yeah, I just try to think out of the box, try to relate the two. And that's primarily what I did. To give a little more background, I have a background in technology, and we used to have connections between sensors and wireless and Internet of Things that Ramanan said talked about. So basically, communication of things to things, vehicles to vehicles, vehicles to everything, and everything to everything. And we took that information and plugged that into healthcare system and used that to be able to access pressure sensing information from hospitals across a city, mine that data, and ensure that all of these devices, which are sitting in different hospitals, will be able to talk to each other. And that in itself is so transformative. If a patient who is running on emergency services, for example, needs to relocate to a new hospital, the movement is very fast. So putting that into perspective of numbers, we were able to bring down operational times of inter-hospital transfer for emergency cases by 450%. And that is, you might think that does not make any difference, but it saves lives. So in terms of supply chain, there's so many elements that you can pick from any basic supply chain and transform it here. And data mining in itself, you might think that elements of, let's say, tagging the data, or maybe using a Bayesian algorithm to mine whatever you're using might not relate directly to healthcare, but it does. And specifically when it comes to prediction on AMR that Dr. Sharma also talked, there are models that are able to predict resistance and susceptibility to mutations just based on the fact that how would a Bayesian algorithm predict the model. And they are able to do that 85% of the times. And I think that's fascinating for an algorithm to tell you how would this protein mutate. And you really don't need a lot of background for it. All you need to understand is how does a k-nearest neighbor is found, how is a support vector working, and then just take that knowledge, implement an algorithm, and translate into healthcare.
Great. Preeti, I think one of the things that I immediately remembered based upon what you were sharing and discussing is one of the first projects. I was, of course, in the private sector before I came to the Atal Innovation Mission. And at TCS, we won when big data analytics had just made its presence felt, in across the world a couple of years ago. The first project was from the University of Irvine, where they were wanting to see why the return rate of in hospitals is at a certain number. People get discharged from the hospital but then they come back. And in US, it's a very big problem because insurance is a big issue. If you have been treated for a particular disease and you have been released from the hospital and then you come back with the same problem or some other related problem, then you have coverage and you have claims problems and all of that. So big data analytics was used to actually analyze the records of last 10 years, over 10 years, the data which was collected on discharge record of patients and the number of patients who came back within a certain period of time, within the 3 months, and could that have been prevented by actually extending their stay by a week or two in the hospital, and thereby the cost of one extra week of stay in the hospital vis-a-vis the cost that you are going to incur because you got discharged and you got readmitted and you have to be treated again, it was a massively different cost that both the hospital was incurring, the insurance companies were incurring, and the patient was incurring. And it was through big data analytics that they were able to find certain correlation between certain diseases which need to be kept for a longer period of time, certain types of profile of patients who need to be kept for a longer period of time, and so on and so forth. So they built all this correlation, and that was only possible because you build great analytics based on data that is mined and which you are trying to find relations. And at least India affords so much possibilities in data analytics and data gathering because India is billion people, and we are having such big problems in our aspirational districts. We have 1 in 5 maternal mortality, 1 in 4 infant stunting, 1 in 3 infant mortality, and so on. So how do you prevent that? And there are factors related to it. It could be nutritional, it could be some source of well water or drinking water that is creating the problem, and so on. So tell me, Jitendar, you have been actually beautifully integrating technology and hardware technology with software technology to create solutions. What is the opportunity for young innovators out there to integrate hardware, software, and sensor technologies to come up with innovations in health data analytics or AI or in healthcare monitoring? Can you throw some light on that? Yeah,
that's a very interesting question. When we first started MedTech Zone from a bare ground as a greenfield project, which now houses more than 80 MedTech companies doing various kinds of work, the first thing we realized that the data people don't talk to hardware people because they are used to computers so much that they don't look at the next guy.
Yeah.
Right, and this is not an Indian problem. This is a global problem.
Yeah.
Now, what hardware companies do in MedTech is that they outsource the data project to someone else, which is a data company. That's the worst thing to do. And that's why when we created the MedTech Zone and we started engaging with companies, first thing we did is that we invited multiple software companies to come and set up their consultancies because we want them to work with the hardware companies. Essentially, in MedTech, there is a very big distinction between II and CI. II we call as isolated innovation, and CI we call as convergent innovation. And you would see that in the data and AI domain, there are more IIs than CIs. Each one is trying to create a solution in itself without integrating it into multiple other pathways. And I'll just give you 2 examples. India tests about 8 to 9 lakh RT-PCR COVID tests in a day. At the peak, about 1 million tests a day. Target from our zone AMTZ is to produce 5 lakh test kits a day. Today we are producing 1.5 lakh tests per day, about 150,000 tests a day. There are many companies in the zone which we have brought in to manufacture the kits. But there are no companies in the country that can actually manufacture the RT-PCR machine itself. Because to make the biologic kit is one thing, but to have machines which can interpret this using the RT-PCR technology, which requires data and understanding of IT with hardware, is totally different. We have just one or say half of a company that's working with someone else trying to make some sort of a machine. All RT-PCR machines, therefore, are imported, which costs a lot. So it's an Indian problem, but it costs a lot to India as well as to Botswana, Bulgaria, Uganda, Nigeria, Vietnam, is also a global problem, because if India were to crack this like they did in pharma or like they did in IT, we could be a global solution. The second example, and I share examples because examples teach us the best. Ventilators are of global importance. Multiple people, including ourselves, we are engaged in it. Ventilators use pressure sensors, oxygen sensors, and temperature sensors, and smart valves. There are sometimes more than 10 valves in a ventilator. Now, integrating pressure sensors, oxygen sensors, flow sensors on a circuit and make it talk to the valves for oxygen, air, compressed air modulation is an IT problem. It's not a medical technology problem, right? And therefore, if our startups can actually be convergent innovators and not isolated innovators, they can actually help the entire medtech industry leapfrog. Because today the algorithms on which the tidal volume loop of a ventilator works on a screen is an absolute IT problem. It has nothing to do with biomedical engineering. The limits that we put on FiO2 from 21% to 100% for a ventilator or oxygen concentrator is an IT problem. It's not a biomedical technology problem. And therefore, I would really urge the smart innovators out there linked to Atal Incubation Mission, linked to Aspire project, all these startups that are engaged in data mining and data work, to come up as a conclusive force, perhaps as a compendium of health IT startups linked to Atal Incubation Mission on the website of AIM, where the hardware guys can actually reach out to and call these people for specific problems in the medical technology value chain. Because once COVID goes away, hopefully soon, wishing well for all, we have other problems that are facing at us. Cancer care is leapfrogging. Cancer as a disease has got neglected in the entire COVID scenario. Thousands and hundreds and thousands of patients across the globe are waiting for treatments because hospitals were closed or overbooked for COVID. Cancer care requires radiotherapy. Radiotherapy requires linear accelerator. There are only 2 companies in the world that make it. If a third company has to come, the beam bending technology that a cancer linear accelerator for radiotherapy uses needs IT and AI people, right? So there are very conclusive problems. And cancer care and linear accelerator is something very big. Let me give you a very small problem. The simplest diagnosis that we need is blood glucose. There is no solution out there that measures blood glucose non-invasively. So millions of people out there in the world prick their fingers every day to take a drop of blood to check diabetes. There is nothing, and it's an AI problem. Can thermal imaging, non-invasive ear temperature, pulse oximetry be a solution if algorithms can back it with precision that non-invasive blood glucose testing be possible? We all talk of maternal death. We have about 45,000 maternal deaths in India per annum. The snake bite deaths in India is 54,000. There is no solution in the country today that can actually say whether a snake bite is poisonous or not. There is no test for snake bites. And there are
That's actually shocking. That's actually shocking.
Yes. And there are 4 categories of snakes in India, 5 categories: Elaparidi, Viperidi, King Cobra, Viper. And each species of snake has a specific bite mark. Can 1 million images of snake bites in the form of an app tell a nurse whether a snake bite is poisonous or not, and if yes, what should be the dose? Yes, it's possible. We have not ventured into those practical problems. Because right from linear accelerator for cancer care to snake bites to non-invasive glucose monitoring, we need AI and data experts to come up, work in converging innovation domain with medical technology to improvise on the MedTech solutions that we have so that we get solutions in the market as soon as we can. And I think that's possible only under the leadership of Atal Incubation Mission. If you can put together these people who are aligned to your vision and mission, we can put together the MedTech industry and the entrepreneurs so that we can create this critical mass of partnerships that can give us the next bunch of solutions.
That's wonderful, Jitendra ji, and I'm going to take you up on that because I think what you have just suggested is there are hundreds of, I mean, though we have launched 3 challenges in 3 very broad categories, we will build a portal of challenges that are out there which need solutions. And these are sort of challenges that you talked about. I mean, day-to-day challenges. How are you going to, one are the more complicated ones, like why can't we build our own RT-PCR machinery in India rather than having to import it? And the other is these common problems of detection, of using AI very effectively because we have the numbers. I mean, when you have 54,000 snake bites which are happening and people are dying because of that, that's a huge amount of data for us to analyze on a regular basis and just see, you know, what is the common pattern that we are seeing here, right? And using imaging technologies and so on. So we'll work together to build a portal of challenges that not only your organization can pose, but others across the country can pose so that becomes a ready repository of challenges that need innovation and where we don't have solutions, or we have solutions but which have to be imported from outside. So why don't we create indigenous solutions? And I thought, I mean, it's very important that you brought out this aspect. How do you move from an individual innovation mindset to a convergent innovation mindset? That is the secret sauce of great innovation that's going to define innovation in the future. You are not going to have individual innovators who are going to come and say, I got the solution for everything that the world needs. You need collaborative innovation, you need convergent innovation. And you also brought out how important it is that the hardware, software, and analytical technologies all come together, because only when they come together with domain expertise that is required, because you know, the software guy understands algorithms, the hardware guy understands the technology, but it's the domain guy who, you know, bridges the gap between, you know, what this software and what this hardware is supposed to actually create as an outcome. And how do you analyze something? So the analytic part requires that domain knowledge. So, and also I love the example that you gave of, you know, small industries. At the end of the day, this innovation is being targeted towards micro, small and medium enterprises and the small industries. And I want to now come to Preeti. You know, you gave a very interesting example of how COVID-19 was actually detected by social media rather than by any healthcare professional across in China. And that's a revelation to me too, that I didn't know about this. But that is a very powerful example of how we need to probably go beyond just hardware, software, and domain expertise into collaborating with other people who may play an important role. And here, for example, how social media played an important role in healthcare detection. I mean, healthcare issue detection, and how social media and AI on that can also play a role on analytics and proposing potential solutions or finding patterns of solutions. Now, please tell me, we are targeting for these challenges right now for the MSME industry, which is micro, small, medium enterprises and startups. And the primary applicant has to be either an MSME applicant or a startup. If there is an individual innovator out there who wants to respond to this challenge, they have to partner with an MSME applicant or a startup, because we want them to have the necessary support in the manufacturing and the furthering of their particular idea. So what do you see? India is 70% MSME economy. I mean, in terms of people involved, not necessarily. We have 29% of our GDP as MSME GDP, which the Honorable Minister has been saying we want to make it to 50%. But what is the opportunity for the small, medium enterprises to leverage innovation and to start, their innovation journey and thereby create more and more companies and thereby create more and more jobs? Can you please give some ideas on that?
Sure. So I think the first thing to understand here is what is the direction healthcare is taking in the country right now. I think that is a very important segment to understand even before you start planning entering into healthcare sector, because aligning your interests with the country's interests are important when you think in terms of how you are planning your own company. So in that sense, understanding what the announcement was made on 15th August about everybody getting a health ID. What does that mean for me as an MSME person, or just like a small business owner, or an entrepreneur, or just an innovator? What does it mean for me from that perspective? And I think from once you understand that bit, it kind of unfolds in a seamless fashion that you're able to understand, okay, a health ID is being created by the government, but then they're also creating this huge sandbox tool that any small business can use and build on top of it, which will help me as a small company to be able. So I already have tools that I need. And then all I need to understand is, this is my business. This is the tools that the government is giving me. How are the two ends matching? And that kind of simplifies the whole problem when it comes to what is the value proposition? What is the value that I'm bringing to the table? And as far as funding goes, and as far as the first bit of finding the product market fit, if I were to use the terms of entrepreneurs, the product market fit is already laid out on table for you. So going back to what Dr. Sharma was talking about, understanding that there is a need versus actually creating a solution sometimes is even simpler than you can think. So you don't really need to come up with your own machine that stores data. All you have to do is walk into the next room and talk to the guy who actually has the hardware. So in that sense, I think just starting from basics, I think that is very important, especially understanding what the government's vision is going to be. So NITI Aayog also puts out these vision documents where it talks about how the health care industry or health of an individual should be. What would be the vision that entails getting to a healthcare standard in, say, 10 years from now? That also helps you understand, okay, this is what the vision is and how am I fitting into the puzzle? That is a question that only you can answer for yourself. But there are so many tools out there that you can use right now. And today, I think it is a fascinating time to be an entrepreneur. I wish I was one right now because we are going through a pandemic and we have so many tools that the government is providing. There are people like Ramanan sir who are leading this amazing Atal Innovation Mission, and leaders like Dr. Sharma. I think this is a fascinating time.
Yeah, indeed, Preeti. I also many times wish that I was 25 years younger and entering into the innovation world, or 30 years younger.
Yeah.
Yeah, it's such an exciting world for the young people because they are the dreamers. But during the time when I was growing up, dreamers could only dream. Today, most of the dreamers can actually innovate. They are having access to tools, technologies. They are having access to expertise, and they are having access to a changing mindset. Very importantly, because during my days, you had to become an engineer or a doctor or a government servant. I have become both an engineer and a government servant in my lifetime. And I've been fortunately staying away from doctors so far. But but this is, these were the only options. But today you have an opportunity to contribute in any area, and innovation is going to play an important role. So I know we are running out of time. First of all, I'd like to once again tell all the people who are listening to this, your applications are very, very important. please don't view this as I want to win this award. View this as an opportunity to unleash your creative thinking, that you are going to become part of an innovation journey that this country needs. And once you launch yourself on that innovation journey, I can tell you, whether you win the award or not, you are going on an irreversible journey. You will never want to look back. You want to create the solution, you want to create an impact, and it's an exhilarating feeling. It's a feeling that grips you and doesn't let go of you at all. The second thing is, this application is closing on the 31st of this month. I do hope every one of you are submitting your applications before that time. We want the best solutions to come out from the marketplace and from the innovators' place. So we are looking forward to tremendous response to our request. The third thing I want to say is that the whole idea in this is not only the innovators, but the promising innovations will get support from the incubation network. I mean, that is why we have people like Dr. Jitendar Sharma, who has been very actively supporting not just their incubator startups, but any startup that is there in the medical fraternity and in the medical community. So they are able to bring to bear resources which you would not otherwise have, is not possible for you to access or to invest in. And they would also bring the expertise that is needed to perfect your innovation and make it into a market-ready product. And finally, I do want everyone to look at, from a completely original point of view. Lateral thinking is important. How do you avoid import substitution? We need import substitution, and we need to create an export market. And India provides tremendous potential in whether it is in creating AI-based solutions or hardware, software solutions, building the right analytics for them, and building monitoring systems so that we can ensure that these innovations are successful. So with that, I would like Sharma ji and Preeti, your inspiring advice to the innovators out there who are listening. Your final message on why they should engage in this, and what is it that would inspire them to take the next step. So I turn it over to you, Sharma, and then to Preeti.
Yeah, no, you have already given a fantastic message. I think the start of the journey is not to win the award, but to see the effectiveness of the solution. And all I can say is they will not regret ever being associated with this challenge that you have put forth. Irrespective of they win the award or they don't win the award, if they are in MedTech space, we would love to serve their needs, provide a bridge, and their application is only one of the ways to express their potential. There could be many other ways which we can keep exploring once the relationship starts. So winning or not winning, the real win is getting to know, and therefore they must apply, they must aspire. Once they are into your radar, hook them onto us, we would take them forward in the MedTech value chain.
Wonderful, wonderful, Sharma ji. Yes, Preeti, you're part of the think tank of India, and you're coming across daily in touch with so many people from the industry, from the academia, from the government. Your views and your inspirational message.
I think there's nothing that can beat what Ramanan sir has already said. But all I can say is, if you're on the fence and thinking, should I or should I not apply, I would say just take the plunge, because right now is the most exciting time. I know it's scary, but it is also exciting. For if you're an entrepreneur, it cannot be a better time than this to be working in healthcare technology. There is a living, breathing experiment going on right now. And if you create solutions that help these problems, you will be thankful for taking that plunge to yourself for the rest of your lives. So I think you should go for it.
Yeah, thank you, Preeti ji. And that's a wonderful way of ending it. Take the plunge. It is worth it. You will not regret it. And you would have begun on your innovation journey. And we are there to support you, irrespective of whether you have won it or not. We are constantly looking for good ideas, new ideas, and we will connect you to our network, which is going to boost your innovation and which is going to realize your aspiration. Thank you all very much for participating in this call. Thank you, Dr. Sharma, as well as Preeti, for making this discussion very lively and entertaining, as well as very educative and informative. This is Ramanan, Mission Director of Atal Innovation Mission. Be safe, everybody. Apply before the 31st of October. Look forward to your applications. Look forward to your innovation. And thank you so much for participating. Good evening to every one of you.
Thank you.
Thank you.
Thank you. Thank you.